their whole entire life, such as depression or schizophrenia, would you sign off on them getting assisted suicide?
So I repeat the question. If I had a child that their whole life had been dealing with depression and schizophrenia, would I sign off on assisted
Not
suicide?
like if they had one of those disorders or another kind of mental disorder.
I would evaluate the situation very carefully, and if I thought they had no chance at a decent quality of life, I would consider that.
So you would kill your own child?
I wouldn't look at it like that.
Why?
Why would I not look at it like that, or why would I assist in suicide?
Why would you agree with assisting your child in suicide?
Because the thought of watching them go through every day, I think it really depends on the situation. If it were a disease such as depression that could be cured with possible medication versus something that may not be able to, mental retardation that may not be able to be cured with.
Well, I don't mean mental retardation. I just mean like depression. Let's use that example.
So in talking about just depression, no, I would not.
What if they've had it, alright, they're 16 years old, and they've had it their whole life, and they've had all these treatments, and it's not going away?
I would seek treatment elsewhere for my child.
What if 5 doctors agreed and said that it's not going to get any better no matter what they do?
Again, I think I would evaluate the situation. What are the current symptoms? What is my child going through each day? Is she living a quality of life good to her and others surrounding her?
Well, the child is miserable and the child wants to die.
I think as a parent that would be very hard.
Why?
Because as a parent, I would think it would be a horrific thing to ever see your child die, no matter what the circumstances.
So, would you say that you agree with euthanasia?
Again, I think it depends on the exact circumstances. I think I can't say yes or no based on just a broad spectrum. I would have to have more details.
Okay, so what if your grandmother was in the hospital on life support and she had made it clear before she was unconscious and stuff that she wanted to die, she didn't want to lay in a hospital bed like that? Do you think that's okay? And doctors have said there's no chance of her getting better.
So in that particular scenario, knowing my age and knowing what my grandmother's age would be, then yes, I would agree with assisted suicide in that.